Hi, good evening. We're going to discuss a very important topic called angina. So let's start with the first question is what is angina? Angina, also known as angina pectoris, is basically chest pain or discomfort that occurs when the heart doesn't get enough blood or oxygen. Okay, this is what we commonly call as angina and it presents as chest pain. Now, what causes angina? Okay, basically it's caused because of reduced blood supply to the heart. Why? Either because of a blood clot in the blood vessels that supply the heart. Sometimes we call it ruptured plaque in those blood vessels. Then you have a reduced pumping activity, okay, stiffness in the arteries. So basically, when there is an acute block in the artery of the heart, the blood supply to that part of the heart muscle gets affected, and this causes the pain which we call angina or myocardial ischemia. What are the signs and symptoms basically of angina? And the simple question is, does everyone have the same symptoms? Okay, no. Angina can present as severe suffocating chest pain. It can present with severe pain that radiates. You can get it to the chest, to the back, sometimes to the neck, even down into the epigastric region. So there's no typical standard type of chest pain that we feel, but any form of chest discomfort or pain in the set that doesn't seem to be settling needs to be evaluated. You might not also necessarily get only chest pain. So what we call anginal equivalents are breathlessness, tiredness, sometimes just fatigue. Okay, and of course, you can even present with giddiness or fainting episodes. What do you do, or what is the treatment for chest pain? Basically, whenever you experience any form of chest pain, any form of chest discomfort, you need to see your doctor or go to the local hospital immediately. Basically, what the doctor will do is evaluate this chest pain. They must do an ECG. They may do some simple blood tests. If there is definite angina, then significant or specific treatment like blood thinners, like statins, like beta blockers, these are medication that the doctor will start for you. If there is nothing significant seen on the ECG, then they will call you for other tests like a 2D echo, like a stress test. If there are ECG changes or there are changes of a severe angina or even suggestive of a heart attack, or we call a myocardial infarction, yes, then hospitalization and immediate treatment is a must. Hence, you must never ignore any form of chest pain and it must be evaluated. Now, how can this angina pectoris be prevented? Basically, once you either you know or you have a history of ischemic heart or you have episodes suggestive of angina, you are on medication, you need to know several things. One is a complete and absolute cessation, stop smoking, absolute, not even the one cigarette. Two, you must you must control all your other risk factors. Your sugars must be under control. Your diabetes must be under control. Your cholesterol and triglycerides must be brought under control with medication as well as with lifestyle change. And what is the lifestyle change? A healthy diet, a healthy work schedule, and physical activity. So when we say physical activity, at least 150 minutes of moderate activity a week, which is not really difficult in anyone's busy lifestyle. But if you can get like a 10 minutes of strength training also really will help. Nowadays, in this day and age, it's a lot of matter of reducing your stress levels. So yoga, meditation, anything that works for you is good. You must limit your alcohol consumption, very, very important. And most important, do not stop your medication unless advised by the doctor. So you continue and regularly take whatever medication has been advised by your doctor. Do not ignore any chest pain or angina. You must be evaluated as soon as possible, and you must follow all the guidelines given to you by a doctor. This will ensure that you have a healthy life ahead. Thank you.